From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tenori, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo! Welcome back. Dr. Jason here, Dental Lighthouse Podcast. Little impromptu recording today. Normally Wednesday, it's Wednesday at 10 a.m. And as most of you guys know, I try to stick to a extremely rigid ideal week template. I normally have a one-on-one coaching client every Wednesday at 10 a.m. But he has a longer surgery today and asked me to bump it to 10:30. So we did that a few weeks ago, but I never really filled this half hour from 10 to 10:30. So I was like, what can I do? Oh, you know what? Maybe I'll hop on the computer and do a podcast recording, which may or may not fall on its face because I usually try to be somewhat prepared for these. And for this one, I'm not. So it's going to be a bunch of ramblings and musings and some things that have happened to me that I think could be relevant to you and your team. So first off, had the opportunity to spend 4 days in Golden, Colorado. I went to the University of Dayton, and the crew that I met my freshman year, literally the first week I got on campus, a bunch of us have stayed super tight for over 30 years, and we try to meet up at least once every 1 to 2 years for an event. So I won't bore you with the details of that event, but it was awesome. I did write about it in a blog that you can read about on our Dental Lighthouse Facebook page. And the premise is, when you plan things and you schedule them, they actually occur. So often in life we hear about, I should do that, or I gotta, or I'll get to that, or what have you. And it's just been my experience that if you make it a priority, if it's important to you, it finds a checklist. So this trip is very, very important to me. So it ends up on my yearly checklist. And if it ends up on a yearly checklist, then it gets scheduled. And if it gets scheduled, it gets done. And I think that philosophy works with many, many things in life, from daily workouts to quarterly weekend trips with your spouse to weekly lunches with your office manager, right? So stop dreaming about it. Stop thinking, that would be cool. Create daily, weekly, monthly, quarterly, yearly checklists. Put the important things on those checklists. And then when you revisit them on a regular cadence, take them from the checklist to your schedule, get it scheduled. And once it gets scheduled, it's rock solid. It's secured. It's like, I already know what I'm doing at that time. And it also gives you an awesome opportunity to say no, right? So, we as servant leaders want to say yes all the time, but the reality is time is a finite commodity. And if something's already in your schedule and you truly can't do two things at one time, then the answer is no. When you don't have control of your schedule, when you don't have clarity on what you're going to be doing in 15 or 30-minute increments on a day-to-day basis, I can guarantee you that other people and other things are going to fill that gap. And you're going to be running around with your head cut off, putting out fires. And at the end of the day, kind of look at yourself in the mirror and be like, did I get shit done today? So again, I wasn't planning on talking about that, but if you want to hear more about that story, that 4-day weekend in Golden, Colorado, and some of the systems that I use to try to make sure that important stuff in my life gets done, you can read about it on our Finger Lakes, not Finger Lakes, on our Dental Lighthouse Facebook page. But the real thing I wanted to talk about today was, and I've mentioned it before in the podcast, but it's been on my mind for a couple of reasons, and I'll unpack it today, is this idea of younger associates and younger hygienists, and I'm not trying to be age discriminatory because it could happen with older people too, but I traditionally see it with younger people, and I experience it myself as a young professional of this concept of being fearful of telling patients what they really need. And it runs rampant in our communities, our professional communities. I know as a young dentist, the number one thing in my mind was to not upset the patient, not rock the boat. So I would do everything I could to avoid confrontation. My treatment plans were extremely conservative. I would only diagnose and treatment plan things that were blatantly obvious, broken cusp, obvious decay on an X-ray, something like that. And again, that was because I had a scarcity mindset. I was fearful that the patient was going to doubt me. I was fearful of rejection. Um, and I don't know if that's just how the world works when you're young, but if I could collapse time for some of my younger listeners, some of my younger hygienists, some of my younger doctors, it would be to try your best to nip that fear in the bud as soon as you can. So, a couple simple examples of how it's crazy to have this mindset, period. But when you look at this mindset in other professions, you really realize it's crazy. So, a couple cases in point, right? So, yesterday I had my twin boys, my 14-year-old boys are freshmen in high school, and I was at their football game, and I was sitting in the bleachers, and for the first time, pretty much ever, I had to actually start squinting my eyes to make sure I could read the jersey numbers on the field. And the field wasn't miles away. The field was like literally maybe 35, 40, maybe 50 feet away. So the entire game, I'm squinting my eyes so I could see. And I'm thinking to myself, I should probably go get my eyes checked. And I have gotten my eyes checked on a fairly regular basis, maybe mainly because of my profession, mainly because I wore magnification for my entire clinical career up till 5.5x. Um, so I have a regular cadence of getting my eyes checked, I think about every 2 years. So I'm going to make an appointment. And that appointment could go one of two ways. To bring it back to dentistry, what if I go into this eye doctor appointment and I'm accusatory of the doctor? I'm like, what do you mean my vision's not doing well? I can't, why didn't you find this before? I can't believe that this is the first time I'm hearing of it. Which makes absolutely no sense, right? I'm getting older. I turned 50 this year. And things in my world are starting to deteriorate. And that's just what happens, right? So for me to go into this optometry appointment, guns blazing and being like, I can't believe you didn't find this 2 years ago. I've been coming here for regular appointments and now all of a sudden I have to squint to see my son's jersey number on the field. Like that's ridiculous, right? We would never do that. So why do we have this fear as hygienists and as younger doctors of presenting treatment, needed treatment to someone and being fearful of how they're going to respond? So let's just to keep it simple, let's keep it in the hygiene world, right? Um, it's ridiculous to think that someone that's healthy from a gingival perspective is going to stay healthy for the rest of their life. As you age, things happen. Your hormones change, your stress levels change, your cortisol levels change, your habits at home in terms of your home care change, your diet changes. Like life gets in the way, aging happens. So these patients that could have been either somewhat healthy or maybe they had gingivitis, and we were still doing like bloody prophies. Like, why are we so afraid to tell them what's going on? Well, I can tell you that the fear is like this stupid example I just made with the optometrist is the patient being like, How did this happen? Where is this coming from? I've been coming here at least once a year for the last 10 years, and this is the first I'm hearing from it. So you almost feel like, as a provider, you almost feel like the victim, oh, is this my fault? No, it's not your fault because things change. Like nothing stays the same indefinitely. So it's our inability as young hygienists, as young doctors, to tell patients what they truly need. And instead, because we fear rejection, because we fear confrontation, because we fear all of these things, we're going to sugarcoat it or we're going to avoid it or we're going to be ambiguous and say, well, there could be something going on here. Let's check it next time, right? What a disservice that we're doing. These patients are coming to our office because they trust us. There's a gazillion dentists out there, and they're coming to us because they trust us, they trust the experience, they have friends and family, they've heard good reviews, whatever it is. And then for us to not do our job as professionals and tell them what's truly going on, mainly because we have this fear of, oh my gosh, what are they going to say? Like, again, I see in my own organization, we're blessed to have lots of doctors, lots of hygienists, and some of the younger ones truly get fearful about telling the patient what they ultimately need. So again, if I were you as an owner doctor or as a leader in your organization or as a lead hygienist, lead doctor, operations manager, office manager, and you're trying to coach up your providers to not underdiagnose, to not do bloody prophies, to not just patch up fractured marginal ridges with MOD XYZ fillings, start to have conversations with your providers about other situations where it's literally ridiculous to not tell the consumer what they need. I'll give you two other examples that I use a lot. One is the older lady who brings her car into the mechanic, every 3,000 miles, right? And she brings it in, she brings it in, she brings it in, and all of a sudden, one time she brings it in, and then the mechanic's like, well, he identifies the fact that we need to put four new tires on the car, right? Do you think the mechanic is afraid to tell this woman that she needs four new tires? Do you think the mechanic's like, well, what if this woman says to herself, how come he didn't tell me this 3,000 miles ago? That's ridiculous. Like, that would never happen. The reality is the tires are now worn down because that's what happens when you drive on tires. And now these tires need to be replaced. The mechanic is not fearful of having that conversation, nor, if we're going to talk about it from a financial bias perspective, I can guarantee you the mechanic's not saying to himself, she really needs four new tires, but she's a retired woman. She probably doesn't have a lot of financial resources. She probably can't afford four new tires. So I'll just avoid the conversation altogether. And I'll say to her, we might have to talk about your tires in 3,000 miles. Let's wait and see what happens. Ridiculous, right? A month later, she blows out a tire. She gets in an accident. Who's that on? That's on the mechanic, right? Because they were fearful to have the conversation. I feel the same thing is true in dentistry. When we see someone for a number of years and they're quote unquote healthy, or you're doing, bloody prophies, and all of a sudden they start to get a little bit of pocket depth. Why are we so fearful of having an honest and real conversation with the patient about what is going on? Now, again, I don't want you to be on a soapbox and be like, you got periodontal disease, and if you don't take care of this, you don't believe in yourself and you don't believe in health. Like, no, we always have these conversations from a position of curiosity, from a position of empathy. Were you aware that your gums are bleeding more than they normally do? Are you aware that some of the teeth are starting to get a little bit loose? Are you aware that on these x-rays, I'm starting to see a little bit of bone loss, and we might not be able to fix this with just a regular cleaning. It might be time to do dot, 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 right? If the patient is going to fight you on that, if the patient is going to be dismissive of that, if the patient is going to be combative or adversarial of that, then that's on the patient. Like, do your job. Tell them, again, in the most loving way possible, tell them what they need. Tell them that you're concerned. Tell them that's what's going to happen if they don't move forward with treatment. What's most likely going to happen. Educate them on oral systemic. Educate them on all the research with inflammation and Alzheimer's, cardiovascular disease, arthritis, all of that, and make a diagnosis and a treatment plan. And you've done at that point, you've done everything you can and should do in the patient's best interest. Now it's the patient's problem, for lack of a better term. Don't leave that conversation from a perspective of, I'll tell them later, or we'll talk about this in 6 months. It's not fair to the patient. Will every patient be wildly receptive to what your recommendations are? No, of course not. But that's not your concern. Your concern as a healthcare provider is to let Mrs. Jones know exactly where she is, exactly what's happened, what you're seeing as a healthcare professional. Do it with empathy, do it with love, do it through an education perspective, make a diagnosis, strongly recommend a treatment plan, and then go from there. This avoidance of making the right diagnosis and treatment plan for fear of um, how the patient's going to react. Again, no judgment, because this is how I lived my professional life for the first 5 or 6 years. And I would literally see patients deteriorating in front of me. And I, I was selfish. I didn't want to have these conversations for fear of rejection. And because I was selfish, my patients suffered. My patients didn't get the help and the health that they needed when they could have most benefit from it. My patients that had a small marginal ridge fracture and a big MO amalgam um, ended up breaking the tooth and ended up losing the tooth, or ended up breaking the tooth and now it needed endo because of my selfishness, my fear of telling Mr. or Mrs. Jones specifically what they need. Um, so, obviously, I shouldn't say obviously, most people grow out of this phase and most people get to where they need to be from a honest and transparent conversation. But the reality is some people don't. And the other reality is if I can help get providers there sooner, they're going to have a much longer career of fulfillment, and they're going to be able to help, excuse me, they are going to be able to help that many more patients um, throughout their career. So that's the message, guys. And it became really relevant to me today because of, like I said, because of yesterday with my eyes. And then one of my workout buddies this morning was telling me that his blood pressure is running high, which is another great example, right? So he seeing a doctor on a regular basis. His blood pressure is now high. Do you think my workout partner is going to run into his primary care physician and be accusatory, be like, whoa, where's this coming from, doc? My blood pressure is now high. I can't believe you didn't find this 2 years ago when I did a physical. Like nobody's coming at medical doctors like that. No one's coming at optometrists like that. No one's coming at mechanics like that. And no one's going to come at you like that. So put that fear aside and do the right thing for your patients. They trust you. They're going to you because you're a professional and they trust your advice. Do the right thing, make the right diagnosis, present the right treatment plan, do it with love, do it with empathy, put the ball in their court. And once you've done that, you've checked all the boxes. You can do everything possible. You have done everything possible to make sure that you're trying to create the best possible clinical outcome and experience for the patient. So not too bad for a just kind of off the cuff podcast. So I appreciate you hearing me out. A couple of things I wanted to just finish up with. I've been asking you guys to be more diligent about leaving reviews for the podcast, and I want to give a couple shout outs to people that did over the last week. I really, really appreciate it. And it means a lot to me. And the main reason that I'm asking for these 5-star reviews is the more that we get, the more this show gets put in front of other dental professionals, the more that I feel I'm able to fulfill my purpose and just trying to help fold time, collapse time for a lot of people out there in the dental community. So I'm just going to read a couple that were shared this week. So the real deal. Dr. Jason is the real deal. His Dental Lighthouse podcast and coaching have truly improved both my life and my practice. Every episode offers something valuable and practical. I can honestly say we need more people like him in the world. Highly recommend. Wow, that's a thank you so much. That was from Brett. So I really, really appreciate that, Brett. And just one more, just because I like reading about myself. No, I'm just joking. Or am I? Real tips, real talk, a must for dentists and their teams. Hands down, one of my favorite podcasts out there. Jason delivers great insight, not just about running a practice, but about navigating life in and outside of dentistry. Always leaves me feeling more grounded and motivated. That's from Cole. So again, I'm asking you, please, if there's any value to the content that I'm sharing with you, take a few minutes, get on wherever you listen to podcasts. Most of you guys are Apple based on the analytics on my end. And just take a minute to leave me a 5-star review. It would be much, much appreciated. Love you guys. You can always reach out to me if you want to talk shop, if you want to talk about coaching, if you want to just ask for a system that I have in place. My contact information, email and text message, email and cell phone are on the website, thedentallighthouse.com. I'll talk to you soon.
Thank you. That wraps up another episode of the Dental Lighthouse podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tenori, your host. Thank you for listening to the Dental Lighthouse podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.